Okay, so now ask me some questions about phase 1. What do you want to know?
You had mentioned that if the child is wet, change.
Wet.
He's wet. When you're checking on him, he's wet. Take him to the washroom and get him changed.
Okay, you're only checking on him because it's, why are you checking on him?
Because I'm doing my,
Okay, so it's an hour, at an hour and 15 minutes, that's our example, pretend, right? It won't be, but at an hour and 15 minutes, you don't check him, you take him to the bathroom.
and he's wet, let's say.
Oh, when you take him, he's wet.
He's wet.
Okay, so you change him
Changing him neutrally, but then lo and behold, he needs to pee again and he pees
in the toilet.
in the toilet.
Fine, good.
So now I have my
Absolutely. Oh, any peeing in the toilet is cause for Stephen Harper. Big Bird, yes, Big Bird. Yeah, right. Big Bird, Stephen Harper, you know, kind of pretty much. What can I say? Right? No, any peeing in the toilet, whether if he starts peeing not in the toilet and you whip him on and he finishes peeing in the toilet, Big Bird, right? Even though he was wet 5 seconds ago and now you've changed him and now you put him on the toilet and he pees, wow. You want every opportunity for him to make the connection between I pee in the toilet and fabulous things happen. This is the connection you're trying to make. Peeing on the toilet, fabulousness. Peeing anywhere else, nothing. Right? So that's fine. That's fine. Right? So what you don't want him to think is, if I pee on the toilet at certain points of time, fabulousness will occur, but any other point in time, it won't occur. No, no, no. Any peeing on the toilet, fabulousness. Big Bird. Well, I mean, one option, if it's a persistent issue of being peeled away from preferred activity, is have preferred activities that can be done while he's sitting on the toilet, right? Like, you can't use the iPad for two things. You can't use it to keep him happy on the toilet while he's waiting for the sphincter to release, and as a reinforcer, right? But if you can find other reinforcers, then, right, like that's, you know, you get to, okay, you have to leave your video because it's time to go sit on the toilet, but you get the iPad, right, while you're sitting there for 10 minutes, right? And the quicker you finish that, the quicker you can get back to your video. So, right? And if when you're taking him to, when you're on your schedule, whatever it is, let's stop calling it hour and 15 minutes, because I don't want you to think that that should be the schedule, right? Whatever the interval is, right? If every time that interval comes up, he's wet, you've got a problem. The interval's wrong. I mean, that should never happen. Most of the time, when that interval comes up, he should be dry. That's why you did the math in the first place, right? So yeah, you're saying, oh, it's time, oh, look, time to pee, right? So, well, he pees, he gets to read a book, he gets to look at the iPad, he gets to do something that's fun while he's sitting on the toilet, pees, all hell breaks loose, Big Bird, right? Hooray, hurrah. Now he gets to go back to the preferred activity, right? Right? So he shouldn't be wet most of the time at that interval. You start the celebration as soon as the stream stops, right? Oh boy, look at you, wow, that's terrific, look, oh wow, you know, pull, look, let's go, hurry up, let's go. Oh, now if it's food and it's right there, oh, let's get some, right, as you're pulling up and, right, all that's happening, right, you want it to be right, you want it to be as immediate as possible.
Okay, so you don't continue to have them sit on the toilet?
You don't have to have them continue to sit on the toilet. You can be in motion, but you're also making the reinforcer as available as immediately as is humanly possible, right? Like, yeah, like start the celebration.
Hands pulled off and we go outside out there. Bathroom, right there.
Yeah, no, start the celebration in the bathroom. You want that bathroom to be like, I can't wait to go there again, right? My favorite place, right? Because that's where fun happens. Mommy gets excited, daddy gets excited, Nemo comes, Big Bird, reinforcers, praise, oh boy, oh boy. Yeah, the hand dryers and the loud flushing in public bathrooms is a real problem. How old is he?
He's 5.
Okay, so, you know, this is, public bathrooms are a pain because they have toilets that flush at random.
Bathroom, it doesn't flush at random, but he still won't, it's like he just doesn't trust it, that it's not going to make a noise.
This is the school bathroom?
Yeah, yeah.
Okay, so in that kind of situation where you've got a kid who's just really, you know it's the noise and you know it's the toilet, this is a situation where you might actually think about potty, right? Because potties don't flush, right? Potties don't flush. And if you can get him trained on the potty, you then, I mean, the worst that happens is he's trained on the potty, right? And then, you know, you can kind of hopefully gradually transition him once it's really firm.
Do I give him a reinforcer just for sitting, like on the toilet?
Oh, absolutely. If he's afraid to sit on the toilet, then, you know, start doing fun things on the toilet, right? Just sit, you don't care. Keep him with his pants on, I don't care, right? He needs to,
Even if it's just that, starting with pants like fully clothed, just sitting.
absolutely, absolutely. I mean, better if you can get the pants down, because, you know, bonus, you never know, right? And you kind of don't want to give him a long-term image in his head that it's okay to sit on a toilet with your pants up, because that's not actually true. It's weird, right? Plus, it's not, you know, you're never going to get bonus at that point, right? But sure, absolutely, get him happy sitting on the toilet. Again, you have to start where the kid's at. So this is a great question and a great example. If you've got a kid who's afraid of sitting on the toilet, you're not even thinking about training at this point. You're just trying to get him happily sitting on the toilet, playing with his iPad, happily sitting on the toilet, watching a DVD, watching a video, you know, doing a SpongeBob puzzle, set up a little tray in front, you know. Right. I mean, one of my students now is working with a kid who's doing this. She's a behavior interventionist, you know, for young kids with autism. He sits on the toilet. She does all her sessions in the bathroom. They've got a table and him and her, and they do all their work because she's trying to get him used to sitting on the toilet because he was terrified, you know. And she's got him there now, and now every now and then he's starting to pee, so she gets to reinforce, right?
So if he's willing to do with pants on, how long should I allow that?
Well, try not to, I mean, if you can get him to sit there with pants off from the outset, do that. But again, make sure the seat's right, make sure he's well supported, right? Make sure that it's fun. I mean, you've got to distract him. If he's afraid, then he's got to have something that he'll do while he's sitting on the toilet that's so much fun that he only gets when he's sitting on the toilet. And now it's the same thing, right? Like, ooh, you get your iPad if you sit on the toilet. Let's play iPad together. And you're fun and he's fun and you're going back and forth. And he's forgetting that he's sitting on the toilet. Like, oh, geez, I'm on a toilet. I thought I was on a chair. Right? So you got to desensitize him. Yeah, because he thinks he's supposed to pee in the pull-ups. Remember, in his little 6-year-old, 5-year-old, 12-year-old, whatever brain, he thinks he's doing what you want, right? He thinks he's supposed to pee in the pull-ups, right? So it's the first couple times he pees in the toilet that are absolutely pivotal. So, I mean, but the other thing is you might have to, if you've got a kid who's afraid of sitting on the toilet, you might have to use the iPad to let him distract himself while he's sitting on the toilet now, and then once that's kind of over with, then the iPad is for peeing in the toilet, right? I mean, you can change the function of the iPad. Isn't it funny that it's all about the iPad, right? You can change how you use the iPad as you kind of, you know, get there closer and closer. Well, I mean, within reason, you know, you've done the math, so you know when you put him there that he does need to go. Now, some kids are so convinced, that they're supposed to pee in the pull-up, that they'll actually hold. right? So now he's on a 2-hour schedule, and you sit him for 5 or 10 minutes, and nothing happens, and he walks around, and nothing happens, and you finally think, okay, well, right? And he's still holding, because he's still got the underwear on, remember, right? And 2 hours later, now it's been 4 hours, you sit him, and he's holding, and you walk him around, he's holding, and walk around, okay, well, we need to go do something else. Now, 2 hours later, now his bladder's out to here, right? He's still holding because you haven't put the pull-up on him yet, right? Like that kind of kid. How many of you know this kid that I'm talking about? You know, right? The real, right? First of all, what you need to know is it's not going to hurt him. The bladder is a big, huge muscle and it ain't going to burst. Right? So this isn't like a balloon. When it gets too full, it pops, and now the kid's entire abdomen is full of urine. That's not going to happen, right? It's a big, strong muscle, right? It can stretch forever, right? I mean, I've seen kids, Katie has too, like 8, 10 hours, right? They're like red-faced. They're walking around, like they're looking at you, pleading, right? If that's what you're dealing with, you may have to go the short way. You may have to go Katie's way, right? Because it's very hard to train that kind of kid doing it this way, because ultimately nighttime comes, right? And now, right? Now we put the pull-up on so he can go, or not, but you can't. You think to yourself, okay, but I can't let my kid go all night without peeing. That's cruel, and you're right. I mean, you can't, and eventually the bed will get wet. Right, but now you've kind of missed your opportunity. I mean, if you've got a kid who can hold for 15 hours, right, you're going to have to go the short way. So some things the long way won't work for. Okay? So we're trip trained now. Everybody know what we mean by that? We're trip trained. As long as you're on your game. You can be anywhere. If you're in the mall and your interval's up, you go to the bathroom in the mall. If you're at grandma's house and your interval's up, you go to the bathroom at grandma's house. I mean, you have to bring your reinforcers with you wherever you go, right? Big Bird has to come in the bathroom at the mall, which may be a bit weird for the other people in the mall, but you don't care, right? Right? Wear a badge. I'm toilet training, right? I'm Big Bird. Right? Yeah.
Sorry to ask this, the short way for is it in the handout?
This is the short way. The short way is what Katie's going to talk about this afternoon.